How does brain imaging help diagnose stroke? Have you ever wondered how doctors figure out if someone is having a stroke? Brain imaging is a key tool in this process. It allows healthcare professionals to see what is happening inside the brain, helping them determine the type of stroke and how severe it is. The two main types of imaging used are computed tomography and magnetic resonance imaging. Each has its strengths and specific roles in diagnosing strokes. First, brain imaging helps differentiate between two main types of strokes, ischemic and hemorrhagic. Ischemic strokes occur when a blood clot blocks blood flow to the brain. In contrast, hemorrhagic strokes happen when there is bleeding in the brain. Knowing which type of stroke is present is crucial because the treatments for each are very different. For instance, clot-dissolving therapies are effective for ischemic strokes but can worsen hemorrhagic strokes. Computed tomography scans are particularly good at quickly detecting bleeding, as blood shows up clearly on these images. When it comes to early detection of ischemic strokes, magnetic resonance imaging is more sensitive than computed tomography. MRI can identify changes in brain tissue within minutes to an hour after symptoms start. In comparison, computed tomography may take several hours to show visible changes. MRI also provides a more precise view of where the ischemic damage is located and can help determine how much brain tissue is irreversibly damaged versus what might still be saved. Speed and accessibility are also important factors. Computed tomography scans are widely available and can be done quickly, often within minutes. They are typically the first choice in emergency settings for suspected strokes. While MRI is more sensitive and provides detailed information, it is less available and takes longer to perform. Therefore, MRI is often used when computed tomography results are unclear or for follow-up imaging. Brain imaging can also help rule out other conditions that might mimic stroke symptoms, such as brain tumors or infections. This ensures that patients receive the correct diagnosis and treatment. Advanced imaging techniques, like perfusion computed tomography or MRI, can assess blood flow and tissue health, guiding decisions about treatments like thrombectomy or thrombolysis. Finally, imaging findings can provide important information about the severity of the stroke and the patient's prognosis. For example, certain signs on computed tomography can indicate irreversible damage, helping doctors predict clinical outcomes and potential risks, such as bleeding after an ischemic stroke. In summary, brain imaging is essential for diagnosing strokes. It helps quickly differentiate between stroke types, detect early ischemic injury, guide treatment decisions, exclude other diagnoses, and inform prognosis. Computed tomography is often the first tool used due to its speed and availability, especially for detecting bleeding. Meanwhile, magnetic resonance imaging offers greater sensitivity and detail, making it valuable in specialized settings. Together, these imaging methods work to optimize stroke care and improve patient outcomes.